Welcome to Smart PT. My name is Jonathan Reimer. In this week's topic, we're going to talk about achieving more than just pain management with our clients, breaking down compensation patterns, and achieving more long-lasting approaches through a manual therapy type of model of treatment. I think we can get superior results. So let's take, for example, the rotator cuff. A lot of us think, oh, rotator cuff, modalities, rotational exercises, cookie cutter type treatment plans. I want us to think more in terms of how do we get more sustained, long-lasting results. So basically, the first thing I'm going to take a look at, is there a high pain, chemical, inflammatory type component? I am going to address that. Usually we can address that in a fairly short period of time, within a few weeks. However, that pain management is not correction of the problem in my mind. So the next thing I'm going to look at, as we're decreasing the pain, I'm going to look at how do I improve the posture. We all know posture is very important in managing rotator cuff problems. It's not as simple though as just telling somebody stand up straight while you do these exercises, or stand up straight throughout your day. If there's barriers, mechanical barriers to them actually being able to do that, for example, fixated thoracic segments, capsular tightness around the shoulder, they're not going to be able to achieve that very easily. So my goal as a manual therapist is to take a look at those barriers and break them down and give people appropriate exercises to deal with those. After we've achieved some improved postural mobility, what we want to take a look at is strengthening into that postural alignment. That's very important. So that's our base strengthening. It's also supportive of our rotator cuff musculature through our mid-back. When we've achieved that, the next step is to start adding in more functional type of movements specific to the rotator cuff, but not really into provocative positions. So I'm going to start with postural alignment and symmetry and mobility, then strengthening into that postural alignment and mobility, then starting to add in specific strengthening for the rotator cuff musculature. And finally, the next and final step would be now moving into more functional, provocative movements of the rotator cuff. As things have really settled down and we've gained our base, our solid base, then we can start actually restoring rotator cuff function.